What is second or alternative opinion of neurosurgeon or spine surgeon? So in real life there are quite often situations when patient has seen one or sometimes several specialists who have recommended one or another type of surgical treatment. But still patient or patient's relatives are in doubt. Is it really needed? Is this surgery really needed, or is this surgery appropriate for the exact situation? And that happens quite often, and this is completely normal and natural. Patients want to have some kind of peace of mind that indeed the surgical treatment which has been offered to them is the right one. And naturally these people are seeking for the alternative or second or sometimes third opinion of other specialists to have a confirmation that this exact surgical treatment plan is correct, and they can go ahead with this plan, and it is really needed and really appropriate. The problem in real life is that seeking alternative or second opinion is quite challenging because of long waiting lists. For example, someone is facing surgery within a week or two, but second opinion is available in 2 months. In order to solve this problem, we have created a digital solution, which is a patient portal. So what it is, basically patient is going into the portal. By the way, I will leave a link in description to this video. Patient can log into patient portal. He or she can upload information about his or her complaints. He or she can upload any additional information, and he or she can upload radiological images like MRI, CT scan or X-ray information. And since the vast majority of decisions in neurosurgery and spinal surgery are made on the basis of the patient's complaints and results of radiological studies, specialists, for example me or any of my colleagues, can make a judgment on the basis of the symptoms of the patients and what we can see on radiological images, which is enough to produce independent conclusion and provide the best or several best treatment plans for exact patient's problem. For example, a couple of weeks ago I saw the patient. She was a middle-aged woman. She was, prior to me, she was seeing another specialist who recommended a surgical treatment of cervical spine on the basis of the evidence of disc herniation in cervical spine. But patient was in doubt. Do I really need this treatment? And the problem with this patient was that this patient was completely asymptomatic, so she didn't have any symptoms whatsoever. And our philosophy is the following: we are not treating the MRI scans, we are treating the patient. And since the patient is completely symptom-free, whatever disc herniation is visible on the scans, we are not going to operate the patient if she is completely symptom-free. So in this particular case, I did not recommend patient a surgical treatment. In this particular case, I recommended patient to engage with physiotherapy in order to build up paraspinal deep muscles, which is a universal prophylaxis of any kind of disc disease in spine. But this does not mean that this patient may not develop any kind of symptoms in future. This of course can happen, and that is going to be a complete game changer. And if this patient, for example, develops symptoms 3 days or 3 years later down the line, it will be a completely different story, and in that case we may consider a surgical treatment. But the trick is that no one actually knows if this is going to happen anytime in future. The good thing about second opinion via patient portal is that you or your relative can get alternative second opinion conclusion within 3 working days, and patient portal is acceptable from anywhere in the world where is internet connection. And the conclusion of the second opinion with our recommendation will arrive via official clinical letter to your indicated email address. It will be password protected, and the password for the document will arrive separately to the mobile phone in form of SMS.